Infective endocarditis. Infective endocarditis is an infection of the endocardium, which is the inner lining of the heart chambers and the surface of the heart valves. It is typically caused by microorganisms, predominantly bacteria, that enter the bloodstream. While a healthy heart is generally resistant to infection, rare instances can occur due to extensive blood infections or highly virulent organisms. Bacteria typically do not adhere easily to the surface of an intact endocardium. The constant flow of blood helps prevent bacterial attachment, and the immune system usually destroys the bacteria before they can cause an infection. An abnormality of the endocardium is generally necessary for endocarditis to develop. Major risk factors include having prosthetic valves or other intracardiac devices, congenital heart defects, heart valve disorders, hypertrophic cardiomyopathy, and a history of endocarditis. Endothelial injury may lead to direct colonization by virulent organisms or the formation of blood clots, which then serve as a platform for bacterial attachment. Infections of the endocardium predominantly occur on the heart's left side. The causative organisms of endocarditis can originate from distant infected areas like skin abscesses or urinary tract infections, or they may enter the body via a contaminated central line or injection. Additionally, bacteria from the normal oral flora can infect the endocardium if they enter the bloodstream during invasive dental procedures. The causative organisms of infection vary, but streptococci and staphylococci are responsible for most cases. Bacterial growth can form vegetations that may lead to heart valve dysfunction, audible as murmurs, and potentially result in congestive heart failure. Myocardial abscesses and tissue destruction can cause cardiac conduction issues. Pieces of bacterial vegetation, known as emboli, may break free and travel through the bloodstream, blocking arteries. Emboli from right-sided infections can travel to the lungs, causing pulmonary infarction and respiratory symptoms, while left-sided infections can lead to other complications. Embolisms can travel to various organs, including the brain, kidneys, spleen, and even the heart itself. Small emboli might also reach the skin and eyes, causing tiny red streaks under the fingernails, on fingers, toes, and the whites of the eyes. Additional symptoms include fever, chills, fatigue, and rapid heart. Symptoms may appear suddenly or develop slowly, depending on the endocarditis type. Endocarditis should be suspected when a fever accompanies a heart valve disorder, particularly when distinctive signs, such as red spots on the fingers or the whites of the eyes, are observed. However, diagnosis typically necessitates proof of a blood infection and imaging tests like echocardiography to reveal vegetations on heart valves or heart tissue damage. Treatment involves weeks of intravenous antimicrobial therapy. Identifying the causative organism through blood culture is crucial for determining the correct antibiotic treatment. In cases of severe illness, empirical antibiotic therapy may be initiated before identifying the organism. Some situations may necessitate surgical intervention to repair or replace heart valves. It is also essential to eliminate any potential sources of infection.